In this month's module physical examination, we're going to get into evaluating circulation. So I'm going to take you through a step-by-step approach. So we're going to start with visual inspection of distal tissues. So whenever we're looking at circulation, we're looking at tissues that are far away from the heart. So we want to look at the fingertips, we want to look at the nails, and then we're going to get into palpation. When it comes to palpation, we want to palpate the fingers and hands and compare them to proximal levels. And then we want to even maybe palpate the nose, that's a distal tissue as well, and then also look at the lips. And anything that's far away from the heart will be our best clinical window of evaluating circulation. So once we do visual inspection, once we get into palpation, then we want to actually measure temperatures, proximal and distal. So we use a surface thermometer to measure the difference between, let's say, the shoulder compared to the hand. And then we want to also go in there and use a pulse oximeter to measure the concentration of oxygen in tissues and also evaluate circulation by looking at a perfusion index. So once you have all of those pieces of information together, you'll be able to determine your patient's vasculatory integrity and how well their circulation is. Now, if you take a look at the physiological steps that are really involved with circulation, I mean, it starts with the heart doing its job, right? The heart has to contract, and you have to have adequate cardiac output to have healthy amounts of circulation. And then the lungs have to do their job, and the lungs have to oxygenate that blood. And then once the heart and lungs have done their job, then we're really looking at the vascular system. And autonomic function causing vascular constriction is a key part of this. Sodium retention by the kidneys and aldosterone that have impacts on regulating vascular tone are important. And then we have to also look at the vascular endothelium. The vascular endothelium will release things like endothelial nitric oxide to help with vasodilation and healthy circulation. And then we have things that also impact vascular tone, things such as thyroid hormones, testosterone, estrogen, progesterone. So really the clinical window of looking at circulation and vascular dynamics is a window of many physiological processes that are in place. So we'll go through the examination first and step by step, and then I'll go through some of the things you may need to consider when you see any type of abnormalities, and hopefully you can incorporate this into your practice this month. Okay, so we're going to go into visual inspection for circulation. This involves looking at the face and the limbs. So we can start with the face. You just want to look, first of all, and just look at the lips. With very severe types of circulation issues, you can see like cyanosis around the lips. And then you just want to look at the limbs and just look for color, right? Signs of poor circulation are going to be pallor, whiteness instead of being pink, and really poor circulation. You'll see cyanosis in blue. So you just want to take a look at the skin, look at the color. You're going to see the greatest expression in the nail beds because it's the most distal tissue. They should be nice and pink like this. These are like perfectly healthy nail beds. You can see those. Those are great. And then you can go all the way down, look at the feet. You will see sometimes with many women that'll have their nail polish in, so you lose that window. But even if you don't see the nail bed, you can kind of look at the skin and make sure that it's pink around that area. So those are the key things that you want to do with visual inspection. You're basically looking for pallor and cyanosis. What you'd like to see is pink distal tissues, especially the fingernails will be your best window, and go from there. Okay, now let's talk about palpation. So when you get into palpation, you can start with tip of the nose. And you want to go in and just kind of palpate the tip of the nose because it's a distal tissue from the heart. Now, you're going to see people that have sometimes changes in color of their nose. But if you're not sure what it should feel like, you kind of compare it to like the forehead and just see if there's a big difference between that. People that usually have poor circulation in their nose also have poor circulation in their scalp, and one of the chief complaints they have is that their hair falls out all the time. And those are really due to poor circulation, not related to thyroid or any kind of hormone issues. And then you want to go down into the limbs. When you palpate the limbs, don't use your fingertips. That's pretty creepy. Use your hands, back of the hands, and just palpate the shoulder. And as you go proximal to distal, you're just comparing to see if the temperature is the same or if it starts to change when you get distal. And then do the same thing, palms up. Fingertips, you can use your hands a little bit just because you get better perception there. And then you do the same thing with the legs. You just kind of feel toes, you can kind of feel how they are. And you're hoping to see that the temperature is fairly the same between proximal to distal in the limbs, proximal to distal in the hands. You want to feel the nose tip. It should be similar to the forehead. So let me show you the capillary refill time. Most of you are familiar with the test, but basically you're going to go to the nail. You're going to push down, and you want to see that pink color return in less than 2 seconds. And just like that. And those are nice and normal. They could return in under 2 seconds. You want to make sure you don't have your bottom finger putting pressure on it still. You really want to just let go when you do this test. Sometimes if you keep the finger pushed against your finger, like I'll create some pressure there, it doesn't return because I have that pressure there. So just hold it and let go. Also with your hand that's supporting it, make sure it's not cutting off blood supply. So it's just a gently hold there, or you can even put your hand away from that finger, push down, and let go. Okay, so the next thing we can check after you check palpation is you can check temperature. So this is basically infrared thermometer, a surface thermometer. They're typically used to check for leaks in the vent. You can get them at any hardware store. They're around $40, and they're very, very accurate. So you basically turn it on, and they'll have like a laser that'll point to wherever you're getting temperature from. And if you can see here, it's really accurate, because if I just move off a little bit into the wall, you can see the temperature drops pretty quick. And as soon as I go back on, it comes on. So when you do this test and you guide from proximal to distal tissue, just make sure you're not deviating off, because that'll really change your test. You really want to make sure you see where the light is. So here we can look at the temperature, and we can start up in the shoulder. It's about right around the 89 degrees, and then as we go down, now there will be some changes in temperature for most people, but you want to make sure that the temperature doesn't drop more than 10 degrees using Fahrenheit. So let me go back up. And this is pretty good. Sometimes you'll see like a 12, 13, 15 degree drop. And you can check the other side. Now, of course, they're going to be the same, but sometimes if you have neurovascular patterns where you have entrapment syndromes, like a thoracic outlet syndrome, you might see different changes between one side or the other. Okay. Now, also, you have to be careful when you check these. Sometimes if their hands or on their legs and their legs are warm, it can change them. So be aware of that. And sometimes you might want to just check the temperature without that. At the same time, also, if your table is really cold and they're holding it for a while, that may change it. So just go in quickly and just check it and make sure there aren't those influences as well. And you do the same thing with the legs. So if it's within that 10 degrees, you're within normal ranges for most people. Okay, the next device you can use is a pulse oximeter. So basically, you just insert this right here on the finger. And these are fairly inexpensive. You can get them everywhere if you don't already have one. And you just wait for it to adjust. There we go. And sometimes just how you place it, it can take a few seconds. So you want to look at the top number here. That's the SpO2. That's the oxygen percentage in tissues. And anything below 95% is considered abnormal, and that's when you're worried about cardiopulmonary disease. And anything between 98% to 100% is ideal. And then with some types of functional impairments, you can't see levels that are a little below. And then the second rate number is just the heart rate. If you see levels below 95%, like a 94, 93, 92, I mean, you got to do a really thorough pulmonary examination, and sometimes you even want to have patients take in deep breaths. So if you see, for example, let's say it's 97 right now, less than ideal, go ahead and take some deep breaths and really expand your chest. Usually open your mouth too. Then you give it a second. There's always a delayed response with this. It's not immediate, so be aware of that. Don't get nervous. But you can see it goes back up into a normal range after a few deep breaths. So you can see there's definitely a delay when you use this equipment. Now, if you see someone whose pulse ox is low and they're not, and you can see that deep breaths make a change, that could be just the fact they're not breathing really well. Sometimes people just breathe through their nose instead of through their mouth. Some people don't expand their chest. The people that have tone issues like rigidity, like Parkinson's patients, that really will have very low pulse ox because they're just not expanding their chest. You can measure their chest excursion, just putting your fingers or tape measure around their chest and just seeing how they breathe, if that's an issue. And then if you see that these numbers don't jump no matter how much they attempt to make deep breaths, that's when you're really worried about things like anemia and other types of patterns. So that's where the pulse ox can be very useful to evaluate circulation. Okay, this is an instrument that can be used to look at perfusion indexes, and it can also measure heart rate, SpO2, and it can also measure hemoglobin levels. So we're going to use it just for the perfusion index part of it for today, but you basically just put it on the finger and it'll start doing its job. So the PI is the perfusion index. So you want to see the perfusion index around 1.0. If the perfusion index is a little bit low like this, the most common cause of that is the low blood pressure. This is just the pulse rate. You can see PR, it's pulse rate, and then and that's just the oxygen saturation context. So the advantage of this is you can actually measure perfusion. Perfusion is a reflection of how much blood flow is getting into tissues, and that would be the PI measurement. That's there. Okay, that's another great tool you can use to evaluate circulation. Okay, you're going to see lots of people that have poor circulation, and one of the things you want to first figure out when you see signs of poor circulation is how long have they had it. There are people that are going to tell you that they've had poor circulation their whole life, since they were a kid, and their mom has it, and their sister has it, and everyone in their family has it, and that may be a genetic issue. So there are people that have genetic uniquenesses in different types of receptors. For example, they may have different catecholin receptors or different receptors that retain sodium. There's different autonomic function in different people genetically, and some people will just have poor circulation as a consequence of their genes, and that's just a factor. But the key with that in the history is that they've had it their whole life. It's always been bad. What you're really worried about are recent changes. So they can say, hey, I used to have great circulation, and then 5 or 10 years ago, it started to go the wrong way. My hands are always cold now. Or I always had a little bit of poor circulation with cold hands, but now they're like freezing. And they may even tell you things like they have to wear socks, or they can't be in the same bed as their spouse, because as soon as they touch their spouse in the middle of the night, they jump up because their toes are freezing, and it wakes them up. So those are things you want to dig into more and figure out the timeline and how long they've had poor circulation. So the ones in which you've had poor circulation changes that have happened in a period of time, like say the past year, the past 5 years, past 10 years, gives you some clue of what may be happening to their vascular dynamics. Now, obviously, when you look at poor circulation, the worst thing you can see would be like cyanosis, right? You can see For example, blue lips, blue fingertips, blue hands. You can see clubbing where their nail beds are just circular and grow. Those are signs like there's a pulmonary disease, there's a cardiac disease. It's pretty significant. It's pretty serious. But usually by that point, someone's already evaluated them with some type of cardiopulmonary disease, and it's not a new thing that just got discovered. But if you ever do see those, you're definitely thinking of the more serious types of patterns anytime you see a whole pattern of cyanotic patterns. Clubbing, cyanosis of the lips, cyanosis of the fingertips, and so forth. Now, for most people, it won't be that extreme. You'll just see like pallor, you'll see like white nail beds, you see temperature changes between proximal and distal that are more than 10 degrees. You might see a poor capillary refill time. And then you got to think about all the mechanisms that can impact that. So remember, to have proper circulation, you have to have cardiac output that's normal, to have healthy pulmonary function, you have to have proper autonomics to control vasoconstriction, you would have proper vascular and endothelial growth factors that are released like nitric oxide to help dilate those patterns, those blood vessels. You have to have proper hormones to control vasomotor tone, specifically thyroid and testosterone hormones in men, and in females, thyroid hormones, estrogen and progesterone. You also have to have healthy sodium retention, aldosterone function, healthy adrenal function. And because of all these different variables, you may not have one single thing be the cause of their poor circulation. In a real clinical setting, you may have to go into management of multiple layers of things before you see circulation change. So, for example, a common pattern is someone that has cold hands and cold feet, and they have, let's say, low blood pressure, and the perfusion index is low, and they have a chronic history of hypoglycemia, and maybe they have low cortisol when you measure them, so they may not change overnight. They may need to get out of their hypoglycemia lifestyle pattern for some time, have their cortisol levels go up, have their aldosterone levels become more functional, and maybe over the next few months you start to see some changes in their circulation. Or you could have a person that has hypothyroidism that's never been identified, and their TSH is high. They go on thyroid replacement. Within the next few days, their circulation is totally back to normal. So it could be everything from genetic issues that have always been there to physiological issues that have developed over time, and all the layers of these various physiological factors that have an impact on circulation. In most cases, you're going to have to evaluate it, have a baseline, and as they get healthier, see if those things start to change. Now, people that do have really poor circulation, one of the most common symptoms they have will just be fatigue. And the fatigue they'll have, if it's pretty severe circulation issues, will be cerebral hypoxia that's causing their fatigue. And for them, it'll just be poor endurance. So they have brain function, they just don't have much endurance. So that's a common feature of people that have poor circulation, in addition to really cold hands and really cold feet. So when you go through evaluation, you want to try to figure out what the underlying mechanisms are, but sometimes you may want to just try to improve their circulation and blood flow. And it really could involve using compounds that increase blood flow and circulation. Those are usually things that increase endothelial nitric oxide, and those compounds include vinpocetine. It's a very powerful ENOS activator, hawthorn extract, ginkgo biloba. So those can be used to help with the vascular circulation. But then people that have really low perfusion indexes, you're really looking at just having them use sea salt throughout the day to get some sodium, and then using things like licorice root to activate 11-beta-hydroxysteroid dehydrogenase, which is used to cause sodium retention. So it really depends on those strategies. And for some people, you may never be able to get their circulation improved. There are people that, for example, have been diabetic for many years, and they have peripheral atherosclerosis, and that peripheral atherosclerosis has hardened their arteries, and as they get atherosclerosis, they actually destroy their endothelial cells in their vascular system, so they can't even produce things like ENOS, and they'll end up with things like peripheral arterial disease, and you're not going to expect those people to change with any kind of supplementation. You're really trying to hope you can improve their risk factors and slow down the progression. And then lastly, just a common cause of really poor circulation that's easy to fix is just sedentary lifestyle. So if someone's stuck with that, being able to move and activate their body and get their heart rate to pump up, they're not going to be able to promote vascular endothelial release of nitric oxide, and they'll have poor circulation. And once they start to get into some regular physical activity and they get back on the schedule of maybe working out or going for a walk, you may see some nice changes in their circulation. So those are all the things you should be thinking about once you finish your examination for circulation and you see some things that are off. I hope that's helpful. Thank you so much.